Now, continuing our discussion on pheo, what are the drugs which are used in the pheo? We use prazosin, nitroprusside, metairosin. They are all the ones which are used for the management of the pheo. So, let us quickly run through. Why alpha blockers? Why beta blockers? Which should be the first to manage a case of the pheo is the favorite question of the examiner. And how do you manage the pheo is a very important issue that you should be very sure with. First of all, few important things on pheo. If you look at the large sized pheo, it produces more metabolites. And those metabolites, that is not pure epinephrine or epinephrine, but the metabolites of epinephrine or epinephrine are predominant thing that is released by the large pheos. Agar small pheo diye to, it releases more catecholamines. Sporadic pheo is norepinephrine more than epinephrine. Familial pheo is epinephrine more than norepinephrine. If it is a paraganglioma, then norepinephrine is most predominant. Then chemodectoma, glomus jugulate tumors, they produce norepinephrine predominantly. Ganglioneuromas also norepinephrine. Malignant pheo produces dopamine and HVA, and neuroblastoma also dopamine and HVA is a predominant thing which is being produced is what you need to remember. HVA is homovanillic acid. So this is one hot area for the examiner doctor. So please bookmark it in the UMedico app and set up a reminder. And you can also actually record the voice and how to remember some funny ways you can record the voice and that becomes shared to everybody. Now, in general, हमको सिंपैथेटिक रिसेप्टर्स के ऊपर ज्ञान रहना चाहिए. सो अल्फा बीटा, अल्फा में होता है अल्फा 1 अल्फा 2. अल्फा 2 और प्रीसिनेप्टिक, अल्फा 1 और पोस्ट सिनेप्टिक. अल्फा 1 को स्टिमुलेशन की वजह से क्या होता है? वासोकॉन्स्ट्रिक्शन, इंटेस्टिनल रिलैक्सेशन, यूटेरीन कंट्रैक्शन, प्यूपिलरी डायलेटेशन. इसलिए अल्फा 1 is responsible for uterine contraction is what you have to remember. If you look at the alpha 2 is presynaptic. So it decreases the norepinephrine production. That's the reason clonidine like drugs kya karta hai? They go and cause the alpha 2 receptors get stimulated. They're alpha 2 agonists and that decreases the sympathetic output. And that decreases the hypertension, and hence clonidine is called a antihypertensive. How does it act? Clonidine, this is one important area, doctor. A lot of students will have confusion just on this small point. I'll make you experts, right? This is one common confusion for a lot of students. इसलिए we should whiteboard के पास जाना पड़ेगा. अल्फा 1, अल्फा 2, अल्फा 1 पहले नाम में ही कंफ्यूजन है. 1 पहले आना है, बट अल्फा 1 इज पोस्ट सिनेप्टिक. अल्फा 2 बाद में आना है, मगर अनफॉर्चुनेटली इट इज प्री सिनेप्टिक. हमारे दिमाग के अंदर इन द ब्रेन देयर इज ए सिंपैथेटिक सेंटर. There is a sympathetic center. So, this sympathetic center, इसका प्रॉपर्टी क्या है? यहां आपको प्री-सिनेप्टिक रिसेप्टर्स आर देयर, प्री एंड पोस्ट. सो ए प्री-सिनेप्टिक रिसेप्टर के ऊपर आपको अल्फा 2 रिसेप्टर रहेगा. If this presynaptic receptor is stimulated, then it will decrease the sympathetic outflow, decreases the sympathetic outflow. So clonidine like drug acts centrally. It is the agonist It is the agonist of the alpha 2 receptor. It makes the presynaptic receptor get stimulated, and that decreases the sympathetic outflow, and that acts like an anti-hypertensive is what you need to remember. इसलिए देवियों और सज्जनों, आप यूमेडिको ऐप के अंदर जाके फार्माकोलॉजी में गए तो हाई यील्ड टॉपिक वाइज बोल के एक फोल्डर रहता, उसके अंदर गए तो गर्मा गर्म डिस्कशन है अबाउट ऑटोनॉमिक नर्वस सिस्टम फार्माकोलॉजी. अल्फा 1 क्या करेगा, अल्फा 2 क्या करेगा, क्लोनिडिन कैसे काम करेगा, रेसरपिन कैसे काम करेगा, एकदम आप परफेक्ट हो जाना है. एग्जामिनर को टेंशन आना, अरे क्या बाप, इतना थोप के जैसे आ गए बच्चे. कहां से आ गए? मुरली भरद्वाज, यूट्यूब, इवनिंग फ्री का माल है बोल देना उनको. यू शुड गेट 270 आउट ऑफ 300. देयर इज नो रॉकेट साइंस इन नीट पीजी प्रोवाइडेड योर बेसिक्स आर गुड. अपन को क्या टेंशन होता है फिजियोलॉजी के दिनों में? पहला प्यार, पहला मजा टाइम नहीं मिलता ऑटोनॉमिक नर्वस सिस्टम फिजियोलॉजी पढ़ने का. प्यार खत्म, एग्जाम खत्म, फर्स्ट क्लिनिकल्स में आ गया, फार्माकोलॉजी तो पूरा गोली मार दिया. क्योंकि द वर्स्ट टाइम डॉक्टर वेयर वी गेट स्पॉइल्ड इन मेडिकल कॉलेज इज सेकेंड ईयर. फर्स्ट ईयर तो बहुत टेंशन में पढ़ना पड़ता क्योंकि एग्जाम पास होना, द मोस्ट ब्यूटीफुल गर्ल के साथ हॉस्पिटल को जाना, इसलिए बहुत पढ़ते. 1.5 year इज द स्पॉइलिंग टाइम. हम पढ़ते नहीं. फार्माकोलॉजी को क्यों नहीं पढ़ा? ऑटोनॉमिक नर्वस सिस्टम फार्माकोलॉजी, बिकॉज फिजियोलॉजी नहीं पढ़ा. एंड दैट पैथोलॉजी गेट कैरीड, दैट पैथोलॉजिकल प्रॉब्लम इन अस गेट कैरीड टू जनरल मेडिसिन. तो जब जनरल मेडिसिन में अल्फा क्या मालूम है, अल्फा मालूम नहीं, बीटा मालूम नहीं, then how can we enjoy? So that is the reason we have to repair all those defects. It doesn't take much time, right? We passed all exams anyway. Housemanship भी खत्म हो गया और चल रहा है. So these things hardly require 1 to 2 days, maybe 5 to 6 hours of your investment. अगर कर दिए तो, अगर ऑटोनॉमिक नर्वस सिस्टम फिजियोलॉजी फार्माकोलॉजी को एक्सपर्टीज आ गए तो पूरा दुनिया looks very simple. NEET PG path looks like a red carpeted path is what I want to tell you. So doc, you understood what is alpha 1, what is alpha 2, right? Yes. Madhu is saying, sir, agonist and anti-hypertension did not understand. Can you please repeat? क्यों नहीं बेटा? अगर मधु पूछे तो नहीं रिपीट करे तो क्या है, क्या मजा है? वेरी सिंपल करूंगा. सी डॉक्टर, कभी कभी पहले बार सुने तो जरा एप्रहेंशन रहता है, राइट? एप्रहेंशन रहता है, एंड इन दैट एप्रहेंशन वी डोंट अंडरस्टैंड, बट एक्चुअली कॉन्सेप्ट इज सिंपल. ब्रेन, यू नो ब्रेन, राइट? इधर है, इधर इसमें सिंपैथेटिक सेंटर रहेगा. Sympathetic center. This center is responsible in the hypothalamus to release the sympathetic outflow. In this area, there is a pre-synaptic receptor, post-synaptic receptor. In this pre-synaptic receptor, you are having alpha 2 receptor in the presynaptic area. What is the function of this presynaptic area? It is like a switch. If this is stimulated, then that causes a inhibition of the sympathetic outflow. So that is the reason, if the sympathetic outflow is inhibited, hypertension also will come down. Naturally, you know, if you are angry, your BP shoots. You are not angry, your BP doesn't shoot. So that is the whole idea. So if you give clonidine, what it will do? slowly it will go and come to this, what is this receptor? Alpha 2, which is presynaptic receptor, and it stimulates it, and that in turn will cause inhibition of the sympathetic outflow and hence antihypertensive. So clonidine is hence cheapest, efficient, 30 paisa में मिल जाता clonidine का tablet. Arcamine is a common brand, right? Clonidine, एक जमाने में clonidine is a powerful drug. Nowadays एटलॉल, मेटाप्रोलॉल, उसके बड़े भाई बिटाक्सोलॉल, कोई भी बहुत लाल आ गया, मगर वो लाल दंत मंजन के पहले ओनली हाइपरटेंसिव, lot of old time physicians used to use this clonidine receptor. Okay, so that is what you have to basically remember. So Madhu, you understood, right? If Madhu understood, world understood, right? Now alpha 1 vasoconstriction, intestinal relaxation, uterine contraction, pupillary dilatation, ये सब याद रखो. Alpha 2 is presynaptic, it lead to platelet aggregation and it lead to vasoconstriction and decreased insulin secretion. That's what. But central alpha 2 जो है ना जी, central में रहने वाला alpha 2 रहता है ना, clonidine जहां जाके काम करेगा, that will be antihypertensive. But periphery में alpha 2 जो दिखता है वो vasoconstrictive once more. That is what you have to catch the point. Okay? हाँ. Now beta 2, beta adrenergic receptors, इसका story क्या है? Beta 1, beta 2, beta 3. Beta 1 दिल में है. Beta 2, 2 lungs are there, no? Only one heart, no? So beta 1 is heart, beta 2 is lungs. So bronchodilation, vasodilation, increased glycogenolysis, they are all beta 2. Increased heart rate, increased lipolysis, increased renin secretion, all beta 1. And beta 3 is increased lipolysis is beta 3 is what you have to ultimately remember. Shanti, Shanti, Shanti. Now doctor, what are the 5 P's? P for pressure, hypertension. P for pain, headache. 80% of patients will have headache. Very common symptom of pheo. Perspiration, 71%. Palpitation, 64%. Pallor, 42%. And paroxysms are the 6th P is what you need to remember. But if you call classical triad of pheo, वो क्या होता है? Pain, perspiration, palpitation is what need to be remembered. अगर पेन, हेडेक, पर्सपिरेशन, पैल्पिटेशंस नहीं है तो उसके हिस्ट्री में खाली हाइपरटेंशन है तो वो फियो नहीं होगा, नहीं होगा. So what are the 3 things? Headache, perspiration, palpitations. The triad is called the classical triad is what you need to remember. Hypertension is the common presenting symptom, commonest. It is paroxysmal, episodic. Now, if you look at the pheos, paroxysms, they are found in 10 to 17% patients and daily to monthly, spontaneous 10 to 60 minute duration paroxysms, and they are precipitated by certain things. So, what are the precipitants of the paroxysms of the pheos is a favorite topic of the examiner. Strenuous exercise, drugs, opioids, unopposed beta blockade. That's the reason beta blockade unopposed कभी नहीं देना. Alpha blockade के साथ beta blockade अगर नहीं दिए तो patient will go into paroxysm. So unopposed beta blockade. Any anesthesia आप induce कर रहे, you didn't know that he had pheo, he will end up in sudden paroxysmal spell. Any ACTH, glucagon, metoclopramide, histamine, anything can lead to the development of the precipitation of the paroxysms of the pheo is what you have to remember. Now, if you look at the symptoms of the pheo, it all depends on how much is epi, how much is non-epi. इसके ऊपर depend होता है. Generally, excessive epi-dopamine makes the patient become more symptomatic guy, unlike non-epi. Epi के वजह से, epinephrine के वजह से होने वाला symptoms, what are they? Headache, profuse sweating, palpitations, apprehension, pallor, flushing, etc., etc. Dopamine, because of the dopamine, what are the symptoms? nausea, vomiting, and because of the vasodilatation of the gut are the ones which you see because of the dopamine. And nausea, vomiting है बोल के metoclopramide दे दिए तो खत्म, it will precipitate the paroxysm, is what you need to remember. Pheo also can present with postural hypotension, which is orthostatic. So what is the reason for the postural hypotension of the pheo? Pheo is a state of extracellular fluid contraction. Prolonged catecholamine will remove the postural baroreceptor reflexes. So sometimes adrenomedulin is a substance produced by the pheo. It has a vasodilatory property. Because of that, there can be paroxysmal hypotension is what you need to remember. A ECF contraction can lead to development of hypotension. Please don't forget. Now you will ask, TK sir, ECF contraction क्यों होता है? Why extracellular fluid contraction typically occur in case of the pheo is my question to all of you. So fundamentally, what happens in pheo? There is an intense vasoconstriction. Intense vasoconstriction. And because of that intense vasoconstriction, there is a high pressure when the blood is going to the kidney. Now, we are talking about why there is a ECF contraction. Because once there is an intense vasoconstriction, there is a shift of the fluid and that lead to development of the decreased ECF volume contraction, which lead to development of the postural hypotension. So, you should have a comment on familial pheo. Is the voice loud and clear? Yes? Yeah. Men 2A have familial pheo, 50% pheo, usually bilateral. Men 2B have 50% pheo, usually bilateral. Von Hippel-Lindau also has got pheo in the familial variety. Similarly, neurofibromatosis type 1, familial paraganglioma, tuberous sclerosis, Stooge-Weber, ataxia, telangiectasia, Carney, any of them can have pheo. Carney's triad include in fact pheo plus gastric leiomyoma and pulmonary chondroma is what you are going to emphatically remember. Can you please punch whether the voice is loud and clear, everybody who are online? Yes. So now doctor, if you look at the various tests, urinary tests, blood tests, what is their sensitivity, specificity? Favorite question of the examiner. So you should not forget this important slide you have to bookmark. If you look at the sensitivity, highest sensitivity is for the plasma metanephrines and highest specificity, if you take, you have to calculate urinary catecholamines plus metanephrines have got the highest specificity is what you have to remember. Now, if you look at the 24 hours urine sample and check the for the catecholamines and their products, there is one important point you need to remember, that certain drugs, if the patient is taking, you should stop them at least for 2 weeks before you do the assessment of the biochemical evaluation of pheo. Tricyclics, MAVO inhibitors, levodopa, methyl-dopa, labetalol, propranolol, chloridine, ethanol, sympathomimetics, they can lead to development of false positive tests is what you need to remember. So, plasma catecholamines, for they to be diagnostic, is the image blurred? Can you get the focus? Image looks blurred. Yeah? Can you check whether the image is clear? Fine. Sometimes if the internet is little, yeah. Internet should be good. Dream PG. Yes, very good. So, plasma total catecholamines more than 2000 picograms per ml is one important benchmark to call diagnostic. Now, always endocrinology में हम क्या पढ़े? If any condition is hyper, you do a suppression test. Suppress करने के बाद भी hyper है बोले तो that is a proper hyper. If any condition is hypo, you stimulate and prove that in spite of stimulation there is no rise. That is a proof of hypo. तो पूरा एंडोक्राइनोलॉजी दो चीजों के ऊपर डिपेंड होता है, सप्रेशन करना या स्टिमुलेट करना. हाइपर कंडीशंस को डायग्नोस करने के लिए सप्रेस करके आप दिखाएगा कि सप्रेशन नहीं हो रहा है, एंड हाइपो कंडीशंस को डायग्नोस करने के लिए स्टिमुलेट करेगा और बोलेगा कि स्टिमुलेट करने के बाद भी नहीं बढ़ रहा है. So that is how you basically prove. So what is that suppression test in case of the pheo? You do clonidine suppression. Usually clonidine is known to decrease catecholamines, whereas pheo patients, it can't suppress their plasma norepinephrine levels. Then glucagon stimulation can be used in case of the pheo, but risk is it can lead to hypertensive crisis. Pheo patients will have more than 3x increase if you happen to give glucagon, and that increase more than 3x is an indication of the pheo is what you have to ultimately remember. Now, localization kaise karega aap usko? So, CT abdomen, MRI, MIBG scan you will use. Adrenal pheos, CT can catch 93 to 100% sensitivity, but extra adrenal it is not that good. MRI has a greater sensitivity to detect than the CT to detect the extra adrenal pheos is what you have to ultimately remember. MIBG scan से advantage क्या बोले तो इसका sensitivity कम है मगर specificity बहुत high. It is between 95 to 100% is the specificity if it is MIBG scan is what you need to ultimately remember. So what is MIBG? You will be using I-123 or I-131. Meta-iodobenzyl guanidine is the name of the MIBG. And MIBG catecholamine precursor is taken up by the tumor. That is how you do the MIBG scan. So if you have done a MIBG scan in a 41-year-old individual, you can see a diffusely metastatic pheochromocytoma is detected in the case of the MIBG. Typical appearance of the MIBG scan is what you have to remember.